Welcome to the Body Science Podcast. As always, the information contained in this podcast is for the information purposes only and is not designed to diagnose or be prescriptive to treat, prevent, or manage any injury, disease, or other health-related condition.
Welcome to Body Science HQ, the world of fit, happy, healthy, and I'm really pumped about today's podcast. We have Dr. Ryan Kohler on, and when you hear the credentials behind this human sitting next to me, you're going to go, no way. That's because when I looked at this, I went, you're kidding me. Like, that's a resume. And next to him is Mark, our in-house dietitian. How are you, mate?
Yeah, very good, Greg. Yeah, how are you?
One of the exciting parts here is Mark is actually coaching Dr. Ryan. How do we say this?
I'm good with Ryan.
You're happy with Ryan? Okay.
Yeah, pretty down to
He's
it.
coaching Ryan in his first IFBB Pro Queensland State Champs.
Yeah.
So, mate, you've got the resume that we all want, and you're going to stand on stage. Like, was it something in the genes? Are you just gifted? How did this happen? I mean,
You'd laugh. My parents are so averse to exercise.
Really?
And never achieved in that department. They were obviously cultural music teacher, and my dad is an accountant. They love sport, but they themselves just don't like exercise. You know, we grew up outdoors and playing sport from 3 or 4, and we were in this small town, East London, which is in South Africa, and a gym actually opened up down the road when I was about 15.
Yeah.
And I went down there and actually signed up without even telling my parents with my pocket money.
Nice.
And that was really the start of the exercise journey in a more like formal way for me. And yes, always played sports, still do. Obviously not contact sport. I'll be smashed now, but you golf, tennis, and I'm somewhat active. But the weight training really was something that I just linked into right from the age of 15, and then trained, and because it was great for rugby and wanting to be, And I honestly haven't stopped. I would maybe if I've got a bit of a niggle, I might take a few days off, or we went away for a holiday, say. But in 35 years, I haven't stopped.
Is that right? Mm-hmm. It's really refreshing to talk to someone with your qualifications, which are incredible. And just before we come on, Mike, you're talking about nutrition and products and all. You just don't hear that very often from doctors. And are you unusual in that space, or is there a trend heading there? No. I mean, you just talked about 35 years of lifting, but...
Yeah, because I think, one of my big motivators in getting into sports medicine in the first place, apart from the fact that I cannot work night shift because I'm the worst doctor at night time and a hell of a grumpy without sleep. But
that's the bodybuilder,
I wanted to go into something that I naturally did anyway, health, exercise, eating. And so the medicine aspect sort of just fueled that. But I honestly, Greg, I don't think a lot of doctors do have the knowledge in this space, particularly not supplementation, training, healthy eating. I don't think certainly it would be the minority that did. Yeah. But for me, it just came naturally. And, when I went to university, got stuck into the University of Cape Town gym, and obviously it was supplements and protein powders and egg whites, and used to smash about 80 egg whites a week.
Yeah, I can imagine, yeah.
But so I guess it's a lifestyle that you can either enjoy or not, and make a choice ultimately.
Yeah, I like that. I do like that. Let's rip straight into, you mentioned sports science, and Mark gave me an overview here, and I've actually got it written in front of me. Do you want me to hand it to you so you can actually see what you've done? Because it's impressive.
I'll go with
we got it on one page though.
Yeah.
I mean, you've been everything from South African Springboks doc, Australian Institute of Sport.
Yep.
You've worked with the Brumbies. Mm-hmm. You've worked with the Titans.
Yeah.
I mean, that's a dream come true to most people listening right now. How did you take that step into sport?
Again, at university, I knew that I wanted to be in the sports. While I was studying medicine, I knew sport was where I wanted to go. And in 1985, the Sports Science Institute of South Africa was founded and built in Cape Town, right next to the famous Newlands Rugby Stadium. And that was headed up by Professor Tim Noakes, who's obviously a big name in running and endurance sport. And I actually enrolled in a study. They were looking at muscle biopsies and strength athletes. So I stuck my hand up. I think there was a little bit of a cash incentive to go as a student. You definitely put your hand up for that one. And got to know these guys. And so straight after medical school and doing my internship, I enrolled in a master's in sports medicine, an MPhil degree, and they ran it through the University of Cape Town at the Sports Science Institute. And when I finished that in 2003, I applied for the Stormers and Western Province team physician job, which I got. And that led on to then being contracted to South African Rugby, which I did for 7 years. In fact, I did all three. I did the internationals, plus the Stormers, plus Western Province, and it was a full-time, full-year contract that you dedicated to. And I think ultimately, the thing that I miss the most is the players, and the relationships that you build with the players. And not so much the admin or the board and having to account to the board and attend board meetings as to when players are getting back on the park, but the relationship with the players. And the way I measure it is that, I would never sacrifice their health for the performance of the team. Their health and safety was paramount and came first. But where we could assist in, say, returning a player earlier to the benefit of the team, we would. But again, the measurement was, is this going to be detrimental to the player? If the answer was yes, I ruled them out. Yeah. And so there's a lot of pressure all the time coming from the head coach, and, you having to make these key decisions. And sometimes you feel like the baddie because it's like you're putting a spanner in the works, And yes, it's perceived as glamorous. You're, on field, on TV, running on the field, treating players in hotels, airports, and all the fans and that. But ultimately, I just kept perspective around, they are there for the players, and no one actually cares about who the medical team is. Mm-hmm. And the professional gap that you have to keep with the players and the other management, it's an important marker, because you can't start blurring the lines and the emotional involvement in key medical decision making. Yeah, so I was never buddy with the players, but I always showed them ultimate respect, expected the same from them. And to this day, if I bump into players that or come across players that I worked with, they'll always stop, talk to me, and I thought that's a good indicator that they've still got time for me, that I must have done something right.
Yeah,
that's
great. That's so good.
And even now in the South African team, Dwayne Vermeulen and Dion Fourie are guys that I worked with, when they were youngsters. It makes me feel a bit old, but they're still around, and credit to them, that they've got the longevity in a sport like that.
It's incredible.
Amazing athletes,
Maybe you can jump in briefly, because I'm such a huge rugby fan and fanatic. And
we're going to start talking South African rugby. Here we go.
Very briefly, if you don't mind, Greg, you're talking about the Stormers.
Insert the ad. Sorry, only joking.
Talking about Stormers in Western Province. That's where I was born in Cape Town, and grew up supporting those teams. And then here we are sitting on the couch talking about the time when their doctor. Pretty cool, it's pretty special. Yeah. I mean, it's such a brand in South Africa, the Stormers rugby. Obviously, it is huge, and then everyone, all our listeners, I think, know about the beauty of Cape Town. And then here we are now sitting during the 2023 Rugby World Cup. At this current stage, we're in the pool stages, and probably when this drops, it'll be quarterfinal stage. South Africa are probably taking on France in the quarterfinals. You mentioned Dwayne Vermeulen, still there in the team, still playing now. So it's pretty fascinating, and it's pretty cool that here you are over here with us. You did talk about, maybe just briefly mention those days where you said you used to get on the golf course with them, and a couple of the guys that you would play golf with, and just a couple of the games that would go on.
Well, they relied on me I was essentially firstly the team physician, team doctor, but I was also the golf coordinator. So I would, depending on where we were, I often took my clubs with me on tour. Can you believe it? I was a fanatic, but and I'd be the one teeing up the course, phoning them. Okay, we need four balls, and then checking which players are going to be on there. So, and the blooming coaches, they were in too. In fact, Rusty Erasmus, who's the current director of rugby, I worked with him. I've toured with him, and he's a golf fanatic too. But so competitive. And the nervous thing about playing with him is that there's always money on the hole, and we were so we're not even in his salary bracket, and he's just pounding the dollars on the hole, and I'm just sweating, thinking, oh my God, how am I going to hit this ball? And when you're sitting over a putt for like $300, you don't even have $300. So, but it was good. That was the camaraderie that and a little bit of the social interaction that I did, just so you had to be a part of the team. Yeah. It's a team ultimately, and everyone's a team player, but just how you manage yourself as medical staff in that environment, you got to just keep very clear. But we still had a hell of a lot of fun on the golf course. And in fact, fact, I mean, it's probably what when the Storms of South Africa used to come to Queensland to either play the Reds or to play a test match at Suncorp. And Suncorp for me is the most amazing stadium, probably the best one close to Twickenham that I've been to. We often based ourselves on the Gold Coast and would drive through to Brisbane because this was such an amazing place to be.
Yeah.
So when I started my touring here in 2004, like we got to the Gold Coast and we stayed at the Crown Plaza in Surfers, and then we drove to the field and I just saw these amazing houses and these waterways, and I thought, God, this is heaven, man. and sort of it is a bit of a dream to think, well, I never thought I'd be living here.
Yeah, true.
But rugby opened up those doors. It was through rugby that I got into Australia. We had a test match in 2009 in Cape Town against the Wallabies, and you build up a relationship with the other team's medical teams. In the first year, it's super competitive who's winning. By the second year, you actually don't care. You just want to know where you guys are meeting up for a drink after the game. And Warren McDonald, who was with the Brumbies, then I took over, then he went to Australian rugby. We had a meal and he said, do you want to come and work for the Reds? I thought, that sounds pretty cool. And so, long story short, I couldn't get the registration, the medical registration to work as a doctor in Australia. And anyway, a couple of weeks after that, because Warren lives in Canberra, he said, he rang me up and said, there's a position available at the Australian Institute of Sport. And the rest is history. 6 months later, I'd moved. They'd paid for my visas, my whole family across, and then started the journey in Australia. First in Canberra and then eventually to the Gold Coast, ultimately because I knew I wanted to get to the Gold Coast.
I like that.
Because of what I experienced in 2004.
Yeah.
So was Chris McClellan there at the Titans when you were there? Professor Chris McClellan?
No, it wasn't. No.
Who was running the performance program there when you were there?
Oh gosh, who's Anthony LaFranchi pretty much heads up the performance aspect and manages everything.
He's still there now.
He's still there, yeah. He's still there. He loves his job.
He's good at it too.
Yeah, he's an ex-player. He knows both sides of the coin.
Yeah, okay.
I think he played 100 games for the Titans, to be honest.
Yeah. Okay.
So, and I just think sport opens up amazing opportunity, and it can shape your life and shape your journey just through the people you meet and how you see opportunity come by and not let it slip and go with it. Get out your comfort zone and just go and do something that you haven't done. It's life's short, and I've never been one to sit back and be comfortable. Eventually, like for example, at the AIS, I guess my personality was always to think out the box, and that was a bit restrictive in that sense. But the real key was that I could do my exams. I had to re-specialize here. Although I was a doctor and had the master's degree, I had to do the specialist fellowship exams here. So I actually went to the Australian Institute of Sport as a registrar and retrained and had to eat humble pie, Springboks, and then down to being a registrar. Yeah. And they gave me 2 years to get through the coursework, gave me credits because of what I had done. Normally it's a 4-year journey. They said, okay, based on what you've done, you've got 2 years. You need to do this, your theory exam, your practical exam, and if you don't make it, you're gone on the plane back to South Africa. So the pressure was huge, and it was the hardest I've ever worked in my life. I worked myself to a standstill with a family and a full-time job, but got the job done.
Yeah, nice work. And sports paid nicely from that. Thank you.
Yeah.
This resume is incredible. I do want to step on something you said about, you talked about the people management part that you loved. What was the difference between managing the national team, where you're getting a whole lot of doctor-driven players coming in, versus managing one of the franchises where you have the whole season to have that program? Do you, when it goes national, are you spending more time with the franchise doctors to bring that together? Or I'm asking two questions at once, which is stupid, but I just love this. I love people management. What part did you love more than not? I mean, obviously national team is the greatest thing you can do, but from being a doctor in sport, what was the best play, that the national team or working with the franchises?
I think there's two parts to that. There's the emotional side and the practical side. Yeah. From the emotional side and the pump and the adrenaline, nothing beats a national team, right? But from a practical point of view, it's actually easier managing your own franchise because it's just you, your physios, your trainers, and etc. Then if you're in the national role, which I was, then I had to take on building relationships with the other doctors. Yep. And because there was a group of contracted players, they had to supply injury reports to us as we went. And then at a time, the selection and the selectors would want to know the medical information. So I'd have to pull all that together. So it was about 5 franchises that you had to sort of work with. And I think the difficult thing also was when those players did come into camp, when the franchise players moved into the national camp for periods of time, you had to get on top of the injuries really quickly and reassess every player, check the diagnosis, and come up with a management plan. And I suppose like I said, we never sacrifice players, but you push the boundaries where it's possible. And maybe they felt aggrieved that we played players that they wouldn't have normally played. And coming out of the franchise, that's their top asset. That's their big spend ticket. And here, they didn't really want you to write them off either. Yep. So yeah, I guess 2 hats sometimes. But I try to keep it separate. But I think to answer your question, easier and more focused and effective in a franchise environment.
Yeah, okay.
Whereas you're just piecing together, Super Rugby was 12 weeks, then Tri-Nations, which was like 4, and we'd be back in Australia, New Zealand, and then we had a Currie Cup and then a Northern Hemisphere tour. So you're probably in a Springbok training environment for maybe 2 to 3 months of the year. Well, if you include the training camps, probably 3 months of the year, and the rest of the time you don't see those players.
Yeah.
Yeah.
This podcast is brought to you by the new BC Energy. Need a boost? You want that 160 megs of caffeine, 100% sugar-free, 3 flavours, Ice Blast, Berry Burst, Lime Crush. BC Energy is your answer. Whether you're looking to crush a can or crush a workout, Mark.
Raise the bar, raise the can.
Boom. Which football took its toll the most on the players? Was it playing in like the World Cup where you're backing up over and over again and you're playing with players you probably don't know overly well, so you're going to put yourself in some situations that you might not normally in a week to week, or at the clubs, like at the end of a game, like I know Dr. Max said to me, rugby league is like triage. At the end of a game, it's like chaos in dressing sheds. And I was just wondering from that perspective, is it when the guys are playing nationally and heavily, is that taking a lot more on the players than playing their traditional seasons?
I think it is, Greg. We know statistically, if we look at tournament play across most sports, your injury rates are higher in tournaments.
Yep.
They're least in training, but they still occur. Of training injuries, 50% occur in the gym, interestingly. Within a season, you'll have a set injury rate, which we could monitor and check, and then you got your tournament play. So the attrition rate's higher in a tournament environment for sure, just because of the spacing of the games, and you're trying to manage that the whole time with GPS data. But yeah, I think the mental toll on everyone can't be underestimated as well, and the pressure in tournaments is something you have to experience. Everyone's feeling it. It's great when you win. It's tough when you're losing.
I can imagine.
And, even I had this theory as well that honestly, the games that we won, the injuries were less because the players were celebrating and, looking for the closest beer. But when we lost and it was a very quiet changing room and the coach didn't have much to say, then we definitely would see a lot more bumps come into presenting to the medical team, because after a game, it is quite chaotic, and all you're really trying to do is do a quick check, maybe scan, ultrasound them and say, okay, who's going for an MRI scan here? And it's tough on the road to organize MRI scans because
I can imagine,
because no one really wants to help you ultimately. Whereas in your own town, you've got your go-to radiologists and they'll do it that night for you. But yeah, you're just trying to work out who needs a scan, and are they going to be playing next week? That's the first question the coach will ask you. Is he in next week, or how long is he out for? And you got to start making that kind of assessment real early. Always say that a runny nose is a medical emergency in an international team. that important. But,
Absolutely.
if the worst was just a player coming to me on the Thursday with an upper respiratory tract infection or gastro, and that is just a tough management scenario, more than actual injury, is the medical things like that, because it can rule them out, and
can change the team dynamics pretty quickly.
Yeah. So
you always hear it in the press conference straight away. The press asks the coach, okay, so what's the, we saw that player go off injury. What's the state of the injury? And then the coach straight away is saying, the medical team are busy doing their thing right now, busy doing their assessments. It'll take 24 to 48 hours to find out.
That's right.
It's exactly like you said. You can picture that you guys running around.
Well, it's 7 days a week work because, the players can be recovering on the Tuesday, but we're at the scans, looking at MRIs and stuff. So there's no real break for the medical team other than if you can get that half day Wednesday to get on the golf course. But ultimately, it's a 7 day a week job. And you're always on call. Like if I'm in with the franchise, players can phone you any time of the day or night with a problem, like they're sick the night before a game. And so I think that took a toll in itself. And then the international travel does take a toll as well. And the timing of me moving out of it after 7 or close to 8 years was perfect. I was pretty much cooked and done and burnt out at that point. And the change to Australia and the AIS was just a breath of fresh air. Well, I got to see female athletes, which I didn't really do. And then also had the privilege of working with some amazing Paralympians. So that's, again, opening up
pretty cool,
different avenues of your career,
Yeah, wow.
Mark, I think it's time to talk about Ryan the athlete now.
Ryan the athlete, exactly.
And you've been working closely in that space?
Yeah. I mean, you mentioned coach, and I think that's a bit too far. I haven't quite been your coach, have I? But I've been a dietitian for sure, and I'm very proud to be able to say that.
I think you've done a lot in the coaching space as well.
You've taken care of your training, I know, and you do a lot of your training from home. You've got a home gym, and then you go into the larger gyms on the weekend to mix it up, I know. Yeah. But on the nutrition side, it's been a 12-month process, almost to the month, where you know, I first came to you to get my own injury healed in the hamstring from squash.
Yes.
And then
that's right.
Next thing you were saying that how about a meal plan just to tighten things up?
Yes.
And then we booked in we started seeing results fairly quickly. And then we said, well, how about a photo shoot just to keep you on track?
Right.
Let's do a shoot. And
that was way off my comfort zone.
Totally.
That was on your Insta account, wasn't it?
Yes.
That was that photo.
You saw that.
Gosh, I did.
That was in March. It was in March.
I remember that.
We had some Body Science products in there.
That's right.
Around the pool area.
Yeah, absolutely.
You had
I used them anyway.
Yeah. And we saw a big transformation there when we looked at the photos, because the photo shoot, I think, is so important for our listeners, like to see that it's really motivating, isn't it?
Yeah.
Because then you can look, hey, Ryan, did you realize how much we've achieved in the past 16 weeks? Here's your start. Look at this. You and shoot. And then we said, well, what's next? And then what was next? Well, okay,
we concocted an idea around
the comp,
about competing. So
in total now it's
12 months.
It's 12 months. And how many kilo have you lost?
I'm heading probably to 15 kilograms. I started at 105.5 and I'm sitting just about around 90.5 now.
Can't believe how good you look.
Yeah.
So it's been a journey, but I've loved it, and it's in my DNA. So it hasn't been a chore. It's just sharpening up on a few things and ironing a few things out. And with Mark's expertise in that space, and he's obviously humble, but he's helped me massively in the way I think about training and competition, and he's walked a road with me on the posing side, and how to actually prep and things is been very valuable. It's been amazing to work with Mark and having a good team around me to help out.
It's great.
So,
did you find it difficult, Mark, going, because I mean, you're a world champion yourself in that space up on stage, and obviously you truly understand what happens before you get on stage, and people who have never competed don't get it, like when you're carbs, hydration, the whole lot. Did you have concerns thinking, okay, this one's a doctor?
Absolutely.
And how do I manage that, as well as making sure when he stands on stage he still wants to talk to me when he does?
Absolutely.
That would have been a difficult play.
I was under pressure in the nerves, dealing with a doctor as it is, with an academic as well. But then this concept of you see something like 100 patients a week.
Yeah, I see 100 a week.
So then we're thinking, how are we going to be doing carb depletion and still be seeing your patients? We did that through your photo shoots.
Yeah.
And then this time around, we said, let's have this week off work.
Yeah,
can we try and do that? And so you work the first day of the week, and then you've taken the rest of the week off while we've been in carb depletion. And because it does require all the little things also that goes with stepping on stage.
Oh, you're giving your soul away when you do this.
You are.
It's a tough sport.
You are. And then there's the little thing. There's the being shaved from head to toe. There's the finding the time to get your spray tans.
Yeah.
There's the grooming that you want to think about with everything. Hey,
that's right.
So there's all the posing practice you need to be doing.
Yeah. Have you been working together on that?
I've helped with the posing, but he also had a separate expert posing coach in the field of the federation.
Yeah.
And then I would have a critique and monitor it. But you've been so diligent in your posing. I know, and that's something that we talked about also, just to have that sounding board for Ryan, because Ryan would say, I need to do another gym session, and I would say things like, actually, remember, you're only on stage for a few minutes and you're not lifting weights when you're on stage. Yeah. It's about showing off your best angles, your best presentation, capturing those 5 judges' eyes just for that quick moment. Yeah. And that comes down to posing and showing off your best angles, doesn't it? So let's focus more on being completely confident with the posing. When you're on stage, there's no mirror to look at. You need to just understand your body awareness and knowing how that's going to, and so little things like that.
Yeah, that's where you've been invaluable. You've walked that road, you know what it takes, and you've lived through all of that and achieved highly. So tapping into that expertise is so valuable. It's not only eating, which has been very helpful. And we'd bounce ideas off on, supplements and things and amounts of protein and that. So no, I think Mark's helped with the overall package that you want to present, because they do judge on an overall package.
Absolutely.
From confidence to facial expression, eye contact, and it gets quite detailed. So it becomes a bit of a science, doesn't it?
And then the thing is, I know that Ryan's competitive. Yeah. And we're going into a sport that is somewhat subjective. And these judges, it's what they feel on the day, what they see. Yeah. And it's hard. It's not a pure sport in tennis one-on-one where there's a definite winner on points.
Yes.
And we started off by saying, well, you just be proud to get on stage no matter what.
Absolutely.
But I know that it's becoming more, as we've seen the condition you're in, you start to believe and feel, and so
the hard part is you don't know who you're up against.
That's right.
So that's where you don't, being a first timer in this space, and then maybe if you do a couple of comps, you'll get to know some of the guys and have a chat and see who you're up against. But it's really a complete unknown. So it's maybe a good thing. Ignorance is bliss.
I love it.
I think it's good. Comparing to others, we always talk about that. I think it's nice that you don't really know, you don't get caught up with being psyched out. Potentially is a big thing in the industry. A lot of people in the early years, they get psyched out before they get on stage because they've seen something on social media of what their competitor might be looking like.
And that's such a key theme across sport itself, where either way, if you're in an individual sport, you can only control what you can control. You got to realize what's not in my control, and I cannot exert energy worrying about that or trying to change it when I can't. You want to bring that back to yourself, saying, okay, well, how did I perform on the day? And then, okay, well, in the context of other people, that's the result. It's like, if the team lost, but we did a brilliant medical job, I didn't measure my performance by the scoreboard. I measured my performance on my field. Were the players safe? Did we get guys playing who should have played? And did we control that? Whereas, like you say, Mark, there's so many unknowns sometimes in sport. And I think a lot of people become anxious and waste energy worrying about stuff that isn't
That's right.
That's such valuable information for people to take in.
Yeah.
Really valuable.
Yeah.
How'd you two meet? Did you say you had an injury that needed to be looked at?
Well, luckily it was fixed, because I'd be a bit embarrassing if you were still sitting with an injury.
You won the title too. You won the squash titles this year too, didn't you?
Yeah, well, thank you. Well,
squash?
We're hoping to.
You're hoping to, sorry.
Great sponsors are our squash team.
Do you? Okay, very good.
Body Science squash
It's my favourite squash team in the world.
And so we're under pressure to bring in the trophy. That's right. But Ryan fixed me up on that. I mean, I had a bad hamstring injury and I couldn't seek the answer. Yeah. And then GP referred me to. And that was it. And it was good. Like, so you should talk about your specialist form of treatment that it worked on me and works on so many. Yeah. Because it's quite groundbreaking.
So, you came in with the classic tendinopathy. It's a tendon degenerative injury, which you can tweak and flare up acutely, for example. And in the last 10 years, there's been a massive shift towards biological growth factor treatment in sports medicine. Initially, the Spanish in 2009, they did a seminar in Harley Street in London, and I attended that because we were playing England at the time, just coincided, and they were promoting the use of whole blood as treatment for different sports injuries, and they had treated Rafael Nadal's, patellar tendon. He had patellar tendon issues for a long time. If you look at the pictures of his strap, and they in fact used PRP on Tiger Woods as well.
Okay.
But then it moved into, and I said the word platelet-rich plasma, or PRP, where we realized that we only needed the platelet cells, which have got the growth factors in them. We don't need the red or white blood cells. In fact, they're quite pain-causing. So we actually able to take blood from our patients. We've got a laboratory on site in our practice, and we can separate out the different blood layers and concentrate the platelet cells. And then, my passion has really been ultrasound imaging. We can guide anesthetic to that injury site. You can see the injury on the ultrasound, and you guide your needle into that injury site. And you inject the PRP, the platelets, and it upregulates a repair process that can take sort of 6 to 12 weeks, but where all else has failed, this has been such a savior and turning event. I've worked with it for the last 10 years. I did a study at the AIS looking at PRP treatment for patellar tendinopathy, which we saw a lot in our basketball players and volleyball players in the jumping sports, and it gave good results. It was superior. PRP with exercise therapy was superior to exercise alone.
Okay.
The classic isometric strength training program that you do for tendinopathy, and then just developed it. And so now I'd probably do 2,000 to 3,000 PRP injections a year for different injuries. Yeah. Tendinopathy, and also in arthritis, muscle strain injuries, chronic ligament injuries. It's got a huge diversity of application. Obviously, it's grown in the cosmetic space as well. And, many men and women will go for PRP facials, or that because, again, it's regenerative medicine. It's improving the texture of your collagen and strength of collagen. So that's what we treated in Mark, is we're able to use PRP treatment under ultrasound guidance through a set of 3 treatments, and then he does his exercise rehabilitation and strengthening appropriately to get in the result. And so, and it's, I would say it's a 90% success rate.
Yeah. In that. That's great news, isn't it?
And even for arthritic knees, patients have come in and, please, I don't want to have a knee joint replacement. So I said, well, this is what we've got. This is what we can do. We can also use a shock absorbing gel in your knee as well, but the PRP is important. And we reduce their pain, improve their function. They're happy as Larry and don't go for the op, So it's quite rewarding in that sense.
54, you're singing my song right now. I'll give you that.
There we go. A couple of niggles.
Yeah, exactly. I've got a few niggles we can talk about. That's what everybody wants to hear.
Yeah.
Well, I'm going to say it was an absolute treat talking to you. I mean, obviously, we could sit here for hours and talk. I can tell it's just, we haven't even touched this resume of yours. It's incredible, but I think we might get you on for part 2. Get you back, and
I'd love
to.
Post-comp. I'd love to do it.
And work out how that went. It's, I think a lot of people out there are going to love hearing the story. It's not very often you get a doctor standing on IFBB stage. Like, that's a very impressive.
Thank you, Greg.
Yeah, and thanks for coming on board, and thanks for being supported. I can see Brumbies, Titans, a whole lot of teams that we've crossed paths in, and it's nice to get you on the couch and have a chat. And thanks for your time. I really appreciate it.
No, it's been a pleasure. Thank you so much for the invitation. It's marvelous working in this environment, and to BSC, I think you guys do a massive amount for the community. Your sponsorships and things. You've got quality products. There's no risk of doping associated with them. And so incredible brand that I've had an experience with in BSC.
And mate, the future's strong with Mark driving that forward in the future too. So thank you so much for coming on board, and best of luck.
Yeah.
Thank you.